Hi, everybody. This is Dr. Radialis from the Georgia office. Tonight, I want to introduce a colleague and a dear friend, Mr. Gerald Dukes. Mr. Gerald, I met him a while back, about 5, 6 years ago. He is a very gifted spiritual coach. He has helped me personally and has helped many other people when they're across a life challenge that they need to figure out and overcome. In this fertility journey that we deal with, a lot of times, and some of you will relate to this, the diagnosis is we don't know what's wrong. You know, your tubes are open, your uterus is fine, your hormones are fine, semen analysis is normal, but you can't get pregnant. And that is the time that we need to think outside the box, okay? And then I'm going to break it down in different areas. I'm going to talk about emotional blocks and a lot to do with the subconscious. I have made a few videos back about this because I think it's very important. Um, and sometimes it's trauma that we are not even aware of, okay? Childhood trauma, issues with, your mother, your father, that it's so deep within you that is stored in your subconscious and create like emotional slash energetic spiritual blocks that will not allow you to proceed with pregnancy. As you all know, I like to start this process every Wednesday when we get together with a case that's relevant. So I have this patient, and in her case, her big issue is that she keeps getting these fibroids. I have personally done 2 surgeries prior from me knowing her. She had already had a fibroid removal. And I was talking to her on Friday after I've been in her belly twice, and her fibroids grow really rapidly. So my discussion with her was, yes, we will handle this and we have to find a way to prevent this. So I'm going to use with her certain techniques to do emotional block releases because, for example, fibroids in the alternative world, they're stuck negative emotions towards self, especially as a woman. If you that shattering in our head saying you're not going to be a good mom, or fears of motherhood, or taking the next step, or feeling not worthy to receive, can be stuck in the uterus as fibroids, or in the ovaries as recurrent cysts. What do you think about that, Gerald? Have you seen that in your practice?
I agree 100% with that. So much of what we experience physically is an emotional blockage, whether it is from something that's from an emotional trauma that has recently happened or something that's happened in childhood. And in some cases, it's even back to past lives. It's a karmic thing. So yes, I agree 100% with what you're saying there, that a lot of our issues are emotional blockages.
Yeah, so in your practice, and I know you use different techniques and primary Reiki, how could you help a woman that seems to, for example, the first case that I mentioned, have nothing wrong? You know, it seems like there's nothing wrong. How could you help her?
The first would be to start Reiki, start a course of Reiki treatments, get the energy flowing, start to break down the walls that she's put up, whether they're consciously or subconsciously, and start to get into the root. Ultimately, it would be through speaking and talking and self-discovery within herself, to so that she can find out exactly what it is that she's holding on to, hanging on to, that's creating this blockage.
Yes.
Um,
And that's something that I see also. That is a little bit of more traditional therapy. There has to be that, inner searching. What is it within you? And you can use different facilitators like Gerald, and whether it's psychological, there's hypnotherapy as well. To find within yourself, as you're speaking out loud, it could be journaling. What is it within you? What fear? Is it shame? Is it guilt? I see a lot of that when women have had history of abortions in their youth, and then suddenly they have an issue with trying to get pregnant, and it has to do with a lot of stored guilt. And then as they start their journey and they're trying to get pregnant and they can't, that guilt just get bigger and bigger, and can not only express itself in terms of fertility challenges, because they feel guilty and unworthy to receive because they had to make that decision maybe 20 years before. But also it can escalate to a point of, cancers and other health issues, autoimmune disorders. Because what is an autoimmune disorder but your body attacking you? Well, everything starts in your mind. If you start attacking you in your head, your body will eventually follow. Disease, it's disease. It's a body that's out of harmony, and it all starts at the energetic level, at the emotional, psychological level. Everything starts with a thought. It's very important in this journey to clear out the air, okay? Get rid of not only physical toxicities, that's why we are so adamant about the diet, what type of stuff you put in your body, to do a lot of self-love, okay? Too much strenuous exercise can't happen, but toxic relationships have to be gone, but also toxic thoughts, all right? I see it over and over and over again in the patients that I see. Another thing would be recurring miscarriages. That's another big emotional block. Have you ever encountered that in your practice, Gerald?
Not in my practice, no, but I do. I have experienced it with friends and family members. So it is, yeah. I'm aware of of it. Going back to what you're saying there was one thing you mentioned, they touched on about emotional blockages. I'm sorry, I just lost my train of thought. Sorry, continue. I'm sorry, I just lost
Yes,
my train of
yes.
thought.
So you can interrupt me anytime. You can, if anybody has any experiences on their own, I have personally been exposed to many different techniques, and you get the best out of it. Some of you know that I have, as part of your journey, put you on different meditation types. One that I really like is Ho'oponopono, which is kind of that release, that asking for forgiveness and also giving gratitude. Is a Hawaiian technique. There's Psyche, which is a series of tests to kind of reprogram the subconscious. There's hypnosis. And a few weeks ago, I introduced Lindsay Eastbourne, which is a great fertility hypnotherapist. Things to reprogram those thought process. Yes, tapping. Tapping is a great modality to clear some of those blockages. There's neurolinguistic programming as well, which goes back to those memories, and then kind of gets the color out of it, and then let them become just that, just wisdom for the soul, okay? Instead of having those very strong emotional attachments. Um, and Ms. Lansu says, once one identifies the stagnation and is able to pinpoint whatever is fear, guilt, etc., what's the next step? So that's where people like Gerald comes in, hypnotherapy comes in. Some of the stagnation, you can do multiple techniques, including acupuncture, reiki, okay, which is energy work, also helps with that stagnant energy to be kind of released as well. You can do a lot of self-help in terms of meditation. There's plenty plenty of just free videos on YouTube on fertility affirmations, both at a cognitive and a subconscious level. Okay, there's subliminal messages. There are multiple out there, both general and specific to fertility, both to recurrent miscarriages and to fertility, period, that you can repeatedly go in, because what happens is your 95% of how you function and who you are is your subconscious mind. And fortunately or unfortunately, that is programmed from 0 to 7 years of age. And some of, at that time, you're not even completely aware of your existence. At that time, your brainwave is on alpha and theta. All right. So therefore, the information just goes straight in. And that is without even going into, like he was mentioning, karma or other lives, or, ancestral type of baggage that could be potentially inherited through the DNA. But that's a whole different area that I'm not going to discuss on this one. And then all of that self-discovery that you do in the process. And we are onions, okay? It's very important to be very kind to yourself. We're onions that we gently need to peel, and there's a lot of repetition that needs to occur so we can go from the outside, from feeling, kind of weirded out or whatever it is that's bothering us, to gently reprogram that brain to get the life that it's deserved by us, by divinity. Okay. Would you recommend a regular acupuncturist versus fertility acupuncture? I prefer a fertility acupuncturist or an acupuncturist. It could be a general acupuncturist that is familiarized with fertility, because if you use acupuncture at the wrong time, you can actually cause a miscarriage. I've had a patient that unfortunately had that experience with a general acupuncturist that was not familiar with fertility. And you want to increase chi or energy flow to that area without overdoing it, right? So it has to be very gentle. Fertility acupuncture doesn't hurt, and it should not cause increased bleeding and pain during your periods. So definitely fertility acupuncturist. Can you give some examples of toxic thoughts?
Yes.
So you want to tap on that, Gerald?
Sure, I'll go to that one. Toxic thoughts are anything that's negative. It's the toxic thought process is when we're confronted with a challenge. The first thing that the first thing that most people do is, oh, I can't do that, or if I do that, this will happen, or excuse me, there's no way that I can possibly do that because for this reason, for that reason. It's a toxic thought process is when we are our own worst enemies, right? The important thing to remember is that energy, all things are energy. Your thoughts are energy, your body is energy, the diseases within your body, they're all energy. And energy is designed to move. So when we hang on to something that's negative, it's going to build up in our body, because that is
that's what a tumor is.
Yeah, exactly. We're not allowing it to flow. Yeah.
So if you accept your divine creation, okay, and God, our creator, quantum field, however you want to call it, is unconditional love, and it absolutely loves you. And that's how you're designed to exist. Okay. Anything that deviates from that could cause disease and be a toxic thought. A lot of times, something as simple as looking at yourself in the mirror and going, I'm too fat, I'm too thin, look at my skin, look at my hair, it's awful. Those thoughts,
I don't deserve it.
I don't deserve this, or, oh, here I go again. I failed at this stupid IVF again. And why is this happening to me? You are a co-creator. You're not a victim. And you're absolutely beautiful because you were created in the image of the creator. You are perfect. Like I tell my own kids, if we were all exactly the same color, shape, size, same languages, how boring the world would be. Look at diversity is everywhere. Flowers are different shapes, color, and sizes, trees, the clouds. So you are absolutely perfect the way you are right now in this present moment. And you have to start there. So a very easy exercise is looking at yourself in the mirror and just saying, you are beautiful and I love you. They've done studies about what Gerald was saying, the power of words and the power of thoughts on plants. Okay, you can look it up. Different plants. One was ignored. A little seed was put in the soil. The second one was said bad things. You're horrible. You don't deserve to live. I hate you. And then the third plant was said beautiful things every day, encouragement, grow. I want you here. I want you to develop. I love you. That plant was the one that grew the faster, the biggest, the healthiest, and produced the best fruit. As you can imagine, the one that was ignored just grew normally, and the one that received all the hatred barely grew. So that's how you are, and it starts with you and you. I always say that there are two relationships that are crucial for your existence. Is your relationship with you and your relationship with the universe or your creator. The rest is circumstantial, the rest is bonus. Okay, so love starts with you. So like I said, affirmations. Look at yourself in the mirror and say, you can do it, you're awesome, you're beautiful. All right, you're beautiful right now in this moment. So some are, that's what I'm saying about some of the toxic thoughts, and then that keeps going in your head. And I know, being a woman, those thoughts can get pretty crazy. I joke with my husband. I say, you don't want to be in my head for more than 60 minutes because you are going to be begging to get out of my head. The chatter in a woman's head is absolutely crazy. But even men will have toxic thoughts at times, and we need to eliminate that, because it's almost like you're swallowing poison. All right, you're poisoning yourself. You're poisoning not only your soul, but then eventually your body, because that's stagnant energy. Like I was saying, like I was using the example of the fibroids. I had a patient come in, and she was very frustrated with her fibroids, and we started doing a lot of energy work together, and she had a lot of emotional release. She felt like she was not enough of a woman because she could not reproduce. Like, it's almost like she felt that her family, her friends, her environment was expecting her to have this baby that she could not do, and it was making her sick. It was giving her fibroids. It was getting her blood pressure high. So we started working on that, and I would say between the medical stuff and the supplements and her diet and her energy work and her daily meditations, after 3 failed IVFs and IUIs and God knows what else before she even got to us, she got pregnant at home. So it is possible. We have to sometimes think outside the box. So when sometimes traditional medicine does not have the right answer, maybe we just need to dig within ourselves. All right. So yep. So coming back to what to do, how to handle those negative thoughts, because I know you could identify them. I've been there. You find it. That what's wrong. You know what to do. How to help yourself. Repetition, repetition, repetition. Be a police of your thoughts. When they start going that way, go, no, that's not where we're going. You might need to go for a walk, be in nature, ground yourself. All right. Affirmations, get positive thoughts, positive, TV, anything that's going into your life that it's loving, reassuring. All right. And then there are plenty of healers out there, like Gerald, like I was saying, the hypnotherapist, whether it's Psyche, whether it's Ho'oponopono, where's different modalities of energy work. They're there for you. Okay.
the thing to remember about the energy work is that they all come from the same source, from the creator. It's just that there's so many different styles, like Dr. Verdialis has mentioned. There's Ho'oponopono, there's Psyche, there's Reiki, there's Tongray, there's acupuncture, there's yoga. They all come from the same source, but they work differently for everybody. So if you don't find one that works, keep looking. There's many, many types of energy healing out there. So if you don't find one that doesn't work for you, keep looking. You might just not
Yes.
have found the right one.
All right, Miss Gabrielle, I had 3 kids naturally, then had a loss, a DNC, and I have 2 failed transfers with PGT tested embryos. Yes, you could be dealing with multiple things, all right? You could be dealing with chronic endometritis, okay? Just from the process of having that loss, you could have a chronic inflammation slash infection in the uterus. And then you could be dealing with what we're discussing today. You could be dealing with an energy block, at a subconscious level. You had that loss, and we might need to work through it. So you feel brave and have the courage to just go ahead and, love your body and allow it to go ahead and have another full-term child. But from the medical standpoint, yes, we would need to check for endometritis. Endometriosis, I would not say absolutely not. Highly unlikely. Endometriosis is a condition that will show up early in life. It will show up in the teens and 20s, and not necessarily after 3 children. I would not completely discard it as a possibility. I would kind of put it down in the list of possibilities. Um, and sometimes there is something called silent endometriosis that could get worse later on. And again, an endometriosis, such as adenomyosis, they're inflammatory processes that have to do with a weakened immune system. So those type of scenarios will flare up on a depressed system, and depressed could be just depression and anxiety can depress your immune system and not allowing to work as well, and then allow those things to flare up a little more, which brings us back to those spiritual emotional blocks that sometimes we carry. Anxiety, depression. I mean, they say out there, stress will kill you. It will, because those are negative toxic emotions. Our fight or flight reaction should be short-term use for that running away from the tiger. But when we have the tiger within us all the time, our bodies can run on high and in emergency mode all the time before they start breaking down. So, Gabrielle, you're welcome to reach me through Messenger, Maribel Verdialis. And we can definitely look at your case a little bit more closely and see how we can come up with a plan so you can overcome this challenge that you're facing. So to kind of close up, thank you, Gerald, for joining us tonight. As you all know, I like to practice medicine a little different in a more holistic way. I believe that the magic is in that balance of mind, body, soul. And again, I love you very much. May you all have an amazing rest of your week, and I will see you next week in Spanish.
Thanks for
So
having me. Have a great evening.
have a great night. Bye
Bye-bye.
bye.